Ladies and gentlemen, my name is Hajo Zeeb. I'm a professor of epidemiology here in Bremen, and I'm going to give a very short public health perspective on higher education and Corona. This you may have seen before. It's the Johns Hopkins dashboard showing the spread of cases all over the world, with foci now in Northern America, Latin America, but also Europe and many other countries all over the world. Globally, more than 50 million cases have been registered, and it just shows that it's truly a pandemic that we are dealing with. In different countries, the timescales were slightly different. So in April, the pandemic started to grow in different countries, particularly the US. But you do see, for example, that case numbers in India only increased quite a lot later, and so in other countries. We now have a surge again in several countries in Europe, many countries indeed, but also across other countries in the world, including the US. So the time period of the pandemic differs between countries. COVID has specific characteristics. There is a pre-symptomatic phase of several days before actually the symptoms occur, and this phase may be already a phase where people can infect others. Some causes of infection go entirely without symptoms, and that is especially so among young people, an important fact for higher education and universities. It is not another influenza. The proportion of death to cases is higher, several times higher than in normal influenza, and it ranges from around 4 to 5% to perhaps up to 10% in Italy, depending a little bit on the database. It is more severe in persons who have other diseases, who have comorbidities. There are very few deaths in young people, which is fortunate, but they do still occur. And we have increasing evidence of various long-term effects coming up now. Numerous countermeasures have been taken. First and foremost, physical distancing. Masks are being used widely. Hygiene has been upgraded, washing hands. Many countries have started to run lockdowns, initially also closing borders. And now again, in many countries, there is another second wave of lockdowns occurring. There is hope for a vaccine coming up, and all this has and is still meaning for schools and higher learning institutions that closures are imminent. Some schools are closed, many schools are closed, and digital learning is on the agenda much more than it may have been before, where education happens on-site, distancing, masks, and hybrid education often are means that are being taken. Now, digital learning obviously calls for technology use, and there are needs on both sides, on sides of the staff, teachers, university, lecturers, but also on the student side. There are new skills required from many of us, and management, but also the teachers and the students themselves have to be ready to identify and deal with specific challenges. And that also extends to even more groups, including the families. How are students affected by the pandemic? We took part in the International Student Wellbeing Study led by the University of Antwerp. More than 130,000 students worldwide, and in Germany roughly 5,000 students. And here are just some core results showing some relevance for education. For example, more than 58% reported less contact to friends and also reported a higher learning workload. Almost 50% reported that the change in learning methods caused stress, and they also report depressive symptoms, not necessarily clinical depression, but about 60% reported depressive symptoms. On the other side, 60% roughly were satisfied with the measures taken by their university, which is a good sign. Can we go back to what was normal before Corona, when we reached the post-Corona times? We need to be aware that we had already a number of pandemics in this century, including SARS in 2003, H1N1, MERS, and the current SARS-CoV-2 coronavirus type 2 pandemic. There may be more coming. We do live in the Anthropocene, the era with higher human pressure on the climate, the environment, and the animal habitat, so that zoonotic viruses jumping from animals to humans are just more likely to do so also in the future. So what is the outlook? From my perspective, it is rather unlikely that we will simply return to a pre-corona situation at universities and higher learning institutions. System resilience and flexibility to deal with new demands will be a key, and we probably should do our best to use current experiences for something that might be called a higher education pandemic preparedness. And with that, I'm closing, and I thank you very much.